Welcome back to Wave Listens Live. Joining me now is Dr. Regan Ackerman from Freedom Mini Dental Implants. Always a pleasure having you on Listens Live.
Thank you for having me.
And it's always show and tell, which I love even more. But for those who may have missed you last time or the time before that, tell us a little bit about Freedom Mini Dental Implants and what you do.
Yep. So big question I always get is, what are mini dental implants? So they are a smaller diameter. It's a one-piece diameter titanium dental implant. So it's less invasive and less healing time, and a lot of times a lot less costly than the surgical implants. So what I do with them, I can help people with dentures, struggling with dentures, do snap-in dentures. I can replace missing teeth with them if it's just one tooth. I can get rid of the denture completely. But where I help people out the most is maybe they were told they weren't a candidate for surgical implants. They didn't have enough bone, or they needed bone grafting. Or a lot of people may know the term periodontal disease. They're losing their teeth because of bone loss around the teeth, and they're concerned they may not be a candidate for implants. I have treated a lot of people that have, had to have their teeth removed because of periodontal disease, and I was able to do the mini dental implants.
And you've got some of the examples here as well. You've got the ones that you said are the most common, which is essentially something to replace your denture.
Correct.
You've got the two other ones as well. You tell me which one you want to talk about first.
Yeah, so let's talk about just single teeth first, and we'll progress up to dentures. So a lot of people may be missing some molar teeth. Your big chewers back there. I see tons of patients that had to have their molar teeth removed, and now they can't chew. They can't chew steak. They can't, chew what they want to chew. So this is kind of an example. So these are the mini dental implants, and when I place these, I will numb you up, just local anesthetic. I do not have to do sedation. You can drive yourself to the office, drive yourself home. I'm not making any incisions or stitches. I essentially make a little pilot hole through the gum into the bone. It's a one-piece, small diameter titanium screw, and then you don't have to wait 3-6 months to a year to get your final teeth. You'll come back about 4 to 5 weeks later, and we'll have this nice, pretty, permanent, if it's a single tooth, one tooth, or if it's multiple teeth like this, it'll be a bridge. And then this bridge will get cemented on permanently onto the implants. So you don't have to take anything in and out. If you have a partial or a flipper, you know what I'm talking about because you hate it. You get rid of that. You just have these teeth cemented on. You'll brush them like regular teeth, floss them, and then you can chew steak again and all the good food that you want to chew again. I had actually my mother-in-law was one of my first patients, and she said it best. She said, I felt like I just grew my teeth back. So I thought that was a great way.
And then you look at the actual implants themselves compared to the size of some of those larger ones. Those big ones, they're kind of intimidating. And you look at those, and you're like, that doesn't seem like as much.
Correct. It's a lot less invasive, less healing time. I've had several patients, they go back to work the next day. I've had some patients go back to work the same day. So it's a lot less invasive, and I don't have to have as much bone. And if you're even thinking that this is something that you or maybe a loved one needs, please call the office. It's a free consultation. There's no charge for the consultation. I'm the only dentist there, so we're a small office, and my husband actually will take your x-ray. He's my assistant and works with me. But please call the office if you want to know if you're a candidate. We'll go over cost. You'll see me. I'll do the exam, look at your x-ray, answer any questions you have.
And you like to make sure that, because it is a family business, that you're giving that same level of family feel to everyone that comes in the office.
100%. Just like everybody, you want to be treated. I always say I'm going to treat you how I treat my mom, my dad, my brother or sister. I will. And there's been times when I tell people, this isn't the best solution for you, and I can, give them a referral for what I do think is the best solution. So I will be definitely honest. And we always say too, we're a judgment-free zone. I have so many patients come in. They put themselves last for a long time. They've taken care of their family or their children or loved ones, and things happen. Sometimes your teeth start breaking or falling apart on you, and it happens to the best of us. So we're definitely a judgment-free zone.
All right, and we got a couple examples here. Let's get to those. We'll show a couple of people that have come to you with a couple different problems, and you've been able to address them as needed.
Yes. So this is Janie. Once again, I think this is a perfect example. Judgment-free zone. She came to me. Her teeth were, lots of cavities, breaking, falling apart. She knew she needed to do something. And so we were able to do the permanent teeth for her, which, I just use more implants, and it's a full arch bridge out of a much stronger material. So those teeth are cemented in, they don't come in and out, and she has nothing on the roof of her mouth. So she gets to taste all of her food. She can, eat salads and steaks and, whatever those foods are that you've been missing. So I think we obviously increased her confidence with just that beautiful smile. I
also like how every example that you show here, they look happy in the first picture too, and then they're just as happy but happier in the second one.
100%. So this is Miss Angela, one of my favorite patients. So when I talked about that periodontal disease, she had periodontal disease. Her existing teeth when she came in, she had tons of bone loss. Her gums were receding, and those teeth were very loose, and she knew, they all needed to come out. So we did snap-in dentures for her. And I just love, we worked really hard with her trying to, match size and shape and get her a smile that still, matched her previous smile, but, kind of in a more refreshing way. She wanted to get rid of the gap in the front. And I just love this before and after. And she just exudes confidence now. And she just has a wonderful personality. And now she has those snap-in dentures. She doesn't have to worry about her, loose tooth or the periodontal disease anymore.
And I think a lot of people come to you as well with dentures already in place that I imagine they're just annoyed by, and you can help them just figure out what the next step is.
100%. There's so many people, they like the way their denture looks, but they don't like the way it feels in their mouth because it moves and they have to use lots of glue. So sometimes I can use their existing denture and convert it to a snap-in denture, and that will save cost as well.
A free consultation, visit freedomimplants.com. You can also call 502-937-4930. Dr. Ackerman will get you right. Appreciate you joining us on Listens Live.
Thank you.